SIBO stands for small intestinal bacterial overgrowth. Normally, the small intestine has relatively few bacteria compared to the colon. But in SIBO, there's an excess number of bacteria that accumulate in the small intestine. Why does this happen? Well, patients might have motility problems, like those with diabetes, for example, they have neuropathies, or those with scleroderma. If a patient has an anatomical issue with a stricture, maybe they've had a surgery, they have a surgical blind loop, or they have diverticuli, for example. Also, if they have reduced acid or bile from chronic PPI use or pancreatic insufficiency. So the bacteria, the excess bacteria, ferment carbohydrates in the small bowel, producing hydrogen and methane. And this will lead to bloating, abdominal pain, gas, and altered bowel habits, usually diarrhea. The bacteria also compete for nutrients, and so patients will show sometimes low B12 and high folate. And you diagnose this with the breath test, usually a lactulose or a glucose breath test, measuring the amount of hydrogen and meth. The treatment is with antibiotics, usually a short course of rifaximin, but there may be other antibiotics. Addressing the underlying cause of the motility disorder or anatomy is key. You might do some dietary modifications such as low FODMAP diet or reducing the amount of carbs that you eat to reduce fermentation. But it's important to remember that recurrence is very common, approximately 30 to 50% within 6 to 12 months.